Welcome back to Trading Hour. Well, let's now shift our focus to the primary markets. Dr. Agarwal Health Care is eyeing its D-Street debut with a 3,000 crore IPO, of which 300 crore is a fresh issue. The issue opens today and ends on January 31st. The company aims to repay their borrowings and for general corporate purposes. To discuss this and more on Dr. Agarwal, we have Dr. Amar Agarwal, Chairperson and Non-Executive Director, along with Adil Agarwal, Whole-Time Director and Chief Executive Officer at Dr. Agarwal Health Care. Join us now. Thank you so much, both of you gentlemen, for joining us. Dr. Amar, first up, give us a sense of what exactly are you raising the funds for? What is the current debt on books? What is the finance cost at which this particular debt has been taken? What will be the debt post-IPO and what will be the reduction in the annual finance cost?
So basically, if you see, we are going in for this 3,000 crore IPO. And yesterday, we had the anchor list done up in which we had collected 875 crores. These were from the top marquee anchor investors like the GIC, Government of Singapore Sovereign Fund, Tata Mutual Fund, and White Oak. And all the top players have invested in this. And so we have got an 875 crore book closed yesterday. Now, coming to the money which is coming in from here, basically we are there to reduce our debt. So out of the 300 crores, we are using 195 crores to clear our debt because our eventual aim is to become like a debt-free company. At present, we have got about 209 hospitals and we are opening approximately one hospital every week. So if you see, last year we opened 45 hospitals and this year in the first 6 months, we have opened 30. In our growth, since you asked us the question, the growth also, we are growing for the past 3 years. Our CAGR is at about 38% and our EBITDA growth is at about 42% CAGR. That is the way which we are growing. Another thing is these countries which we are in are 10 countries. So if we are in India and in Africa, approximately, you see, population of India is about 150 crore, population of Africa 150 crore. Between these two areas, we are covering half the world. Our advantage is we are asset light. In other words, I don't need to build a hospital of 400 beds, inpatient beds, because we don't have inpatient facilities at all. So we are able to grow more horizontally as much as we want. In Chennai, as an example, we have about 21 hospitals already existing. In Mumbai, Maharashtra, we have about 26 centers. In Mumbai alone, about 15. So the idea here is for expansion. Look carefully, we are not in Delhi, Uttarakhand, Chhattisgarh, UP, we have one center in Varanasi. That is where I'm saying we can expand so much more. And that is why the business opportunity is huge.
Congratulations, Dr. Agarwal and Adil. Thank you for joining in. This is Rima here. Just a quick question. One hospital per week. What's the eventual aim? When does this expansion stop? Do you have a number in mind, Dr. Agarwal?
Hi, Rima. Thank you for having us firstly on the show. We have gone through a significant phase of expansion over the last 3.5 years. And this is something which we've been doing for the last 5-6 years or so, where you see our footprint has been expanding significantly. We will continue to explore a lot more opportunities across the market. As you can understand, the TAM in our current industry is around 37,800 crores. And one of the reasons why this industry has such a large TAM is India has 275 million people who are affected by some form of visual impairment. And the second requirement also is to serve this kind of a population. India has only 1.8 to 1.9 ophthalmologists for every 100,000 people, whereas the requirement is 8 to 9 eye doctors for every 100,000 people. The third data point I would give you is India, on an average, is only doing about 400 to 500 surgeries for every 100,000 people, whereas many of the developed nations are doing 3 times that amount. Given the increased incidence in cataracts in our country because of a few demographical reasons, the requirement for us to serve this particular market is significant. Although we don't have a particular number in mind, but as we continue to expand our footprint, we will keep looking at more opportunities to meet that requirement and serve more people.
Dr. Amar, we understand that you intend to open one hospital every week or one center every week. Give us a sense of the kind of capex that you have envisaged maybe over the next year or so. We also understand that you intend to reduce debt, but given the fact that the majority of the IPO is via OFS, how exactly will you fund this acquisition? Will you need to take on more debt, or will it be via internal accruals?
A lot of money on internal system, and I'll ask Adil to tell you the numbers in detail of the primary centers, secondary centers, and the tertiary centers, and our capex for that.
We have three different formats of our hospitals. Our largest formats are what we call the tertiary hospitals. These average anywhere between 10,000 to 12,000 square feet, although you have some larger facilities which are north of 40 to 50,000 square feet. On an average, capex for a typical tertiary hospital is about 8 to 12 crores. Then you have a smaller format, which we call as the secondary hospitals, and these average anywhere between 4,000 to 8,000 square feet. Typical capex in these facilities is about 4 to 7 crores. And then you have the smallest formats, which are called the primary centers. Now, we call these the eye clinics, and we use these to cater to smaller micro markets, tier 3 towns, tier 4 towns, different villages. These average between 750 to 1,000 square feet, and total capex requirement for those is about 30 lakhs. Now, given our financial performance, if you see, we have a EBITDA to cash flow ratio conversion of about 85%. So we believe, based on the current situation, we don't require much external capital based on what our current plans are. Our internal accruals and whatever cash and investments we have on our books will suffice to meet our biomedical requirements and our capex requirements over the next 2 to 3 years.
Adil, as you keep expanding, is there a risk to your margins, or do you think you can maintain or expand margins from here on?
So that's a valid question, Rima. If you see, in the last 3 years, in October 2021, we had launched our 100th hospital. In 3.5 years now, we have expanded that footprint to 209 hospitals. Given the fact you have gone through such rampant expansion, we have still managed to maintain our margins at about 29.5%. This data which shows H125 is about 27.3%, but if you average it out for the extrapolated for the rest of the year, these will be close to 29 to 30%. We believe that we will be able to maintain these margins given our performance over the last few years. What we will not comment on is any improvement in margins, but we are fairly confident about maintaining the EBITDA margins at such a level despite our expansion plans. And the reason for that, the reason for that is, if you see, 70 to 75% of our centers we open in our core clusters. Now, core clusters are what we define as where we are present in predominantly the southern states of India, and Maharashtra also we would consider a core cluster. The break-even time it takes the amount of time it takes to break even in some of these regions is a lot faster. As we take on a few more risky bets and we start going to markets where the brand equity is not strong, the break-even period increases. So on an average, our break-even period is around 15 months, so which is why we believe we should be able to maintain these EBITDA margins which we have delivered.
So, Adil, Dr. Amar, if you would like to answer this, it took you 2 years to double your revenues and even double the number of hospitals. Do you think in the next 2 years, if we talk same time, your hospital count and your revenues would have doubled compared to these levels?
We are looking at that as a target. But let's look at those numbers. If you see, you were showing in the screen just now, you showed a turnover of 1,300 something last year. And if you see the turnover of this first 6 months, it's showing 820 crores. You can see the growth. And remember one more thing. Our growth is always in the H2 mode because it's a seasonal variation where patients come for cataract surgery more during winter. So you can extrapolate and you'll see the growth. Perhaps Adil will add more on it.
Adil?
Yes.
Do you think we can double in 2 years?
I would not like to make any commitments on doubling of revenue or doubling the number of centers because this is, there are certain risk factors in our business. For example, our business is built around getting the right set of doctors and providing the right kind of clinical services. Post-COVID, also, we have seen, a healthy kind of growth. And that is a phenomenon which is not just unique to us. Most of the other healthcare players also have seen this kind of growth, predominantly because the Indian population has started to take their health a lot more seriously. But given our expansion plans and given our track record, at least in H1 FY25, we are fairly confident that we should be able to at least keep up with this current growth which we are showing.
Thank you so much, gentlemen, for joining us and giving us a sense of how exactly business is expected to pan out post-listing. Well, ITC